It all started with me wanting to do something for cancer patients. I mean, it's my background and it's something that I'm passionate about. But we wanted to understand exactly how technology can support cancer patients. So what we did was we conducted an in-depth needs assessment, which was a mixture of interviews and a survey and an observational study where we observed how patients were taken through the journey of being diagnosed, counseled about the side effects, and then when they were receiving their medicines, how did they experience the side effects. And from that in-depth study, we were able to understand that patients are often overwhelmed with the amount of information that they're provided. They're often counseled at the wrong time. So for example, they are given their diagnosis and they automatically start counseling them about the medicines. So that means the second half of the discussion is all forgotten. They're given a lot of leaflets with overlapping, sometimes contradictory information. So in the bottom line, patients felt overwhelmed and did not have enough to support themselves while they're at home. And while they're at home and experiencing side effects, they were very reluctant to pick up the phone and call their nurse or call their hospital because they knew how busy people in the NHS are. So they would kind of wait on the symptom. And oftentimes that's not a good idea because it would end up with a complication or a hospital admission. So that reluctance was jeopardizing their safety, if you want. So bottom line, they needed more support while they're at home, and they needed a better format of information. So that was the result of the needs assessment. From there, we were able to say, right, we need to design a prototype that provides these features. And that's where Can Advise came about. So we designed a system. So it's not really, I don't like to call it an app because app is too simple. It's a holistic system that allows patients to report side effects, to also learn about how to manage their side effects safely while at home. The system also asks them how severe it is, so from mild to severe. And based on the responses that the patients are putting in, the system then advises them whether they need to seek immediate help or whether they can stay home and take specific medicines or change their diet or to rest or whatever. Every single thing that the patient is reporting is then being saved into a database that the healthcare professional can then access and remotely monitor the well-being of their patient. So it's a two-way holistic platform with a patient side and a healthcare professional side. At the moment, it's in clinical trial at the Royal Marsden. We had to get ethics for it, and we had to design a protocol and everything, but essentially it's a proof of concept study. And the main hypothesis is, can Advise support patients? Will they use it? Will it be an acceptable solution for patients to use when they do have queries about their medicine or queries about their side effects? So it's an ongoing trial. We've recruited 15 patients so far. It's been overwhelmingly positive. Patients are often upset when I have to take it off their phones because they feel it's like a safety net. It's very reassuring to know that they can enter a side effect and somebody's watching over them virtually without them having to call and be put on hold or to go somewhere. We also, in preparation for today, I also did an analysis of the database to see how many side effects the patients were reporting. And to date, we've got 72 side effects reported by the patients, ranging from mild to severe. So it's been very successful. We are hoping that we can roll it out to a wider population of patients, to any disease state. So not at the moment it's only for breast cancer, but really once you update the content, you can really apply it to any patient living with cancer that needs support with their medicine.